I'm Dr. Ginevra Liptan. I'm a physician specializing in the treatment of fibromyalgia. I have both professional and personal experience with the illness. I was diagnosed with fibromyalgia in the middle of medical school. So I've had to figure out for myself how to understand and treat this pretty mysterious condition. So the first thing we know is that in fibromyalgia, the part of the brain that controls the stress response or the danger response, that part has gone haywire. And what we see is it's like a smoke alarm that's going off all the time, even though there's no fire. So the part of the brain that is telling the body that there's danger around, it should only be doing that when there actually is danger around. But in fibromyalgia, it's doing that all the time, 24 hours a day, even while people are sleeping. And it kind of prevents you from getting into those deeper stages of sleep because your brain is kind of trying to keep you awake so that you can run away from danger, or kind of keep you in that lighter stage of sleep so that you're ready to get up and go. But continually over years and years, only getting that light sleep is what contributes to the fatigue of fibromyalgia, the overall muscle pain, the cognitive dysfunction, the kind of brain fog that people describe. So in order to treat fibromyalgia, you want to first look at what you can do to reduce the fight or flight response. And that's not something that you can control with your brain, but you can with your body. So it's something that deep breathing can help trigger the opposite of the fight or flight response, which is called the relaxation response. So other things that do it are yoga, gentle rhythmic movement like walking, meditation, anything that helps kind of bring your body into a quieter place. And that's why there's been hundreds of studies showing that yoga, exercise, meditation, tai chi, all of those things are helpful in fibromyalgia. The next thing we need to do is work on sleep quality improvement, because no matter how much meditation or yoga or exercise you're doing during the day, once you fall asleep, your brain just is on autopilot. And in fibromyalgia, that autopilot is saying danger, danger, danger. So when you look at sleep studies of people with fibromyalgia, you can see that there's some distinct differences. There's two diagrams that you can see here. The first one is looking at a normal sleep diagram, and this shows somebody going through the normal stages of lighter sleep, REM sleep or dreaming sleep, and then deeper sleep. And you go through a normal cycle about 4 or 5 times, going through each of those phases at night. In fibromyalgia, and you'll see in this diagram, you can see that people don't get into that deeper stage of sleep. They're mostly staying in the lighter stage of sleep and then the REM sleep. So what we need to do to treat this is to really use medications, and there's some natural therapies as well, to help push your brain into deeper sleep. And there's some of the medications that we do use to treat fibromyalgia, that's how they work and how they help, particularly pregabalin and gabapentin. The next thing that we can work on is trying to help some more of those downstream effects. So with fibromyalgia, you're not getting that deep quality sleep that you need. So our muscles end up very tight and inflamed, and that itself is a huge generator of pain. So another way to approach fibromyalgia is to work actually on the muscles itself. And in particular, you want to work on the fascia, the connective tissue that surrounds the muscle. And here's an image of the fascia that you can see. It's sort of the translucent covering that you might see on a raw chicken breast. Humans have that same pattern when we have fascia surrounding our muscles. And when it gets inflamed and painful, it's really painful. Fascia is more sensitive to pain than our skin. And in fibromyalgia, there's been some studies showing that there's some extra levels of inflammation and tightness in the fascia. So to treat that, what we want to do is usually gentle stretches, things like yoga are helpful for that. And then there's a few types of manual therapy that are really, really helpful to reduce that tension and tightness in the fascia. The first one is called myofascial release, and that's really assisted stretching. It's done a lot of times by massage therapists, but it's not massage. It's really kind of gentle, prolonged stretching, very slow, taking 2 or 3 minutes at a time. The final thing that we see is that because you're sleep deprived and because your muscles and fascia are tight and painful, sort of activates the whole nervous system to be more sensitive to any signal, whether it's pain, pain sensitivity, light sensitivity, noise sensitivity. So then the final stage of treatment is to work on kind of calming down the nervous system so that there's not such a hypersensitive or hyperreactive response to stimulus. One of my patients says that she feels like the princess and the pea. You know, she can feel a pea under 40 mattresses. So what we have to do is kind of try and get the nervous system to be less sensitive to the input. And that's where all the medications that you normally think of when you see advertised for fibromyalgia on TV, that's how those work. And those can be really helpful. But that's more at the end of the process. The beginning of the process is working on building tools to bring up your own relaxation response so that you can push down the fight or flight response in your body. Working on sleep, improving sleep quality with medications. Some supplements do that. Some mind-body therapies work and help to do that. Working on sleep hygiene, so having really good habits around sleep will help that. And then working on body work, kind of manual myofascial therapy. And then finally, working on the hypersensitivity to the stimuli in the nervous system. So that's just a really broad overview on kind of what we know about fibromyalgia and how I use that information to treat fibromyalgia. There's some further resources listed here on this slide, and I really encourage you to seek out myofascial release therapy if you've never tried it. You can find a therapist on this website, and then this is my clinic's website and also for my new book.